Hello, everyone. My name is Vajayjay from Salem.
And I'm Lilac. And if you couldn't tell, we're drag queens.
That is very honest. Yes.
We are here today to do a little interview Q&A talk with Dr. Alkire. Very excited about that in regards to LGBTQA plus Health Week.
Yes, we are really excited. We've been working on this for a while. We have the questions in front of us, ready to go. We're going to have a good conversation. And yeah, I'm excited.
Yeah.
I've been doing a little plug here. I'm going to start with the Red Dress Affair I've been doing for 4 years in a row. On my fifth one coming up in June.
Yeah.
Yeah. And so I'm thankful for HFA Alliance for asking us to do this with them. And we are ready to go.
Also, by the way, we are a couple. We're engaged, hence why we're in the same location. Still safe practices with COVID.
Mm-hmm.
So it's all good. We live together. So I guess we're just going to go through this quick little starting topic kind of thing. So this week is LGBTQ plus Health Awareness Week, a time to bring attention to the devastating cycle of discrimination and health disparities that affect lesbian, gay, bisexual, transgender, and queer people. LGBTQ plus people encounter discrimination in employment, relationship, recognition, and insurance coverage on a regular basis. Consequently, they're less likely to be able to afford vital health care that their straight and non-transgender neighbors. For LGBTQ plus people of color, barriers to care and health disparities are even greater. So this is where we're going to turn it over to Dr. Alkire, and he'll kind of give us some information on this / thoughts on LGBTQ plus week / the discrimination and disparities. Is he on here?
So I don't think he's with us yet, but maybe we can look at some of the questions that aren't Dr. Alkire related and see if maybe we can answer them collectively. But just as an introduction, my name is Jesse Quinn. I'm the Development Manager with HIV Alliance. We're very excited to have Lylac and Vajayjay joining us here today. We also have our fabulous staff member, Christina, who will be assisting with some of our translation services. So if you have any questions that you would like answered in Spanish, Christina is able to assist. But yeah, feel free to throw that in the chat if you have anything you would like to share with us. We'll keep an eye out for Dr. Alkire. And once again, I wanted to kind of segue off of what JJ shared about the Red Dress Affair. And if you are unfamiliar with this event, I encourage you to put it on your calendar. It is certainly a showstopper, and we're grateful for all of her support, as well as Lilac's over the year to make this a successful event. So let's just kind of jump into some of the questions that we might be able to answer, not being medical providers, and see what we can do. I think one of the first ones I saw was drag race related. So I'm not quite sure if you have a particular contestant in mind, but who is your favorite to make it to the end?
Well, I have like two that are like I want in like the top three for sure. I'm definitely team Gottmik and team Simone. They have literally just killed me almost every single week. They're so good, gorgeous, talented, all of the above,
Yeah. And those are actually my top two also. I mean, Utica was part of this question here. I mean, she's okay, but I don't think she's in a win the whole thing.
She does have some really creative looks though.
Yeah, she does.
Nice.
Yeah. What about you, Jesse? Who are you rooting for?
I have been checked out of Drag Race since about season 8, and that is more just an issue with accessibility. But one day I'll pay for the subscription and I'll be able to catch up.
Right.
But for now, I'm living in the past. I'm like still dealing with Aquaria, and oh gosh, I'm trying to think. Yeah, Pearl was my little heartthrob for a while. Her and her sleepy eyes.
Yes, yes.
Bless her heart.
Yeah.
Yeah. So let's see. Going through here, I think there's some questions that we might be able to answer collectively.
I think so.
Yeah, and so, let's look at question 19. One of our viewers had submitted, can you get an STI from oral sex? Maybe we can get, oh, what was that, Lilac?
Like, that we can definitely answer. I mean, it's not necessarily like an easy answer, but yes, you can. That is very possible. Yeah.
Yeah, I know with our STI clinic, we often check for 3 ports. And so that is oral cavities, vaginal cavities, as well as anal. And so STDs can occur in the throat, especially when you're engaged in oral sex. So it's important to consider your sexual practices, especially when you're talking to a medical provider and being screened for STIs and STDs. So, make sure that you're just open with your provider, that you're sharing some of your concerns because exposures do exist and can lead to STIs of the throat.
Right. And don't ever feel embarrassed when you talk to your doctor about
Yeah.
anything like that, because that's just what they do.
They're literally there for, to help you with your body, and they want you to be safe, and it should never be something to be embarrassed about.
sure, maybe a little awkward in the beginning of bringing it up, but they're doctors, so.
It's not like they're telling the whole world what you're doing at all.
Right.
They're there for a reason.
Yeah, I know it's super important for me as a gay man to have a provider who is competent in LGBT matters, because I've gone to providers before who have assumed my heterosexuality, and I've just gone in and I'm like, no, I'm not concerned about exposures in XYZ manner. This is how I engage with a partner intimately, and these are some of my concerns. So consider the actions that you engage with, the parts that you use, and find a provider who's willing to ask the questions related to your own health. And so sometimes you might have to be a little more assertive to break down those assumptions or stereotypes, but you can also do a little bit of front end work to find the providers in your community who know how to work with queer populations.
Absolutely.
Yeah. So let's see. Oh, this is kind of an interesting one. Wait, where did it go? What should I do if I think I've been exposed to HIV? Any thoughts about what advice you might give to someone who is concerned with an exposure?
Sounds crazy, but stay calm. Don't freak out initially, because there's a lot of false things and all that. So stay calm is my first suggestion.
And I do happen to know that there is such thing as a post-exposure prophylactic. So it kind of acts sort of like PrEP does, and you can go in a certain time frame after you've been exposed and take this medication, and it will help prevent the likelihood of you, contracting HIV. So I would obviously right away, if somebody thinks that they haven't, go see your doctor, go talk to them. They will know what your next steps are and what testings they need to do and all that.
And if you don't have a doctor, I think you can still go to like clinics and stuff.
Yeah.
Yeah.
And hey, I'm pretty sure HIV Alliance has resources as well to get people in the right direction.
Oh my gosh.
But
I was going to say, you're both hired. We love you so much. I was going to say, I feel like I need to print these instructions and put them on the wall in our lobby. So staying calm is super important.
Yeah.
When we're in emotional states, we can often make, terrible decisions. We can hurt those around us. What we really need is to find out more information in the situation, do a little bit of research, reach out to professionals. And as Lilac mentioned, the professionals could be HIV Alliance. You also raised the issue of PEP. And so PEP is an incredible medication, and that's that post-exposure prophylaxis. So I often compare it to almost a birth control for an HIV exposure. And you can be prescribed PEP up to 72 hours after an exposure. You can walk into any emergency room, explain the situation, and they can prescribe it on site. So if you are concerned of an exposure, do not hesitate in reaching out to a medical provider. As I mentioned, there is a time frame and window in which that medication is viable. So, time is important, but make sure you collect yourself before coming in. That way you can come in with a, calm head before, walking into any situation.
Absolutely.
But if you've been exposed, we really encourage folks to engage with testing often. For individuals in a high risk category, such as gay men, we recommend every 3 months. And so come in, get to know your HIV status, build a routine, set a reminder. It's a really quick and simple process. And through our agency, it's completely free.
That's awesome.
So I feel like that was pretty good advice. Look at us for not being doctors.
Go team, go.
We're not even medical experts.
I feel like we've got this. So, is oral sex safer than anal sex? It's a tough one.
I'm gonna say no. I feel like, either way you can unfortunately get something.
Yeah.
So I mean, either way is probably not the best. I don't know.
I mean, there's always risk with anywhere you're, engaging in sexual practices. It's a matter of being safe and, using condoms or dental dams. Like there's stuff out there to help. I don't know if either or is safer. I personally have not done any kind of research into that.
Yeah, and I really think that this isn't quite an either or situation. I think both of them carry their own level of risk when engaged with a certain activity. And then Christina also threw in a question here that says, what parts do you use for sex? The options are mouth, vagina, penis, and anus. I always explain to folks that yes, it is an awkward question, but we ask this so we know what body parts should be checked for STIs. So that's very helpful. And kind of back to that oral versus anal, I don't think one is of a higher risk category. They both carry their own unique factors that need to be taken into consideration.
Absolutely.
Okay. Let's look here. Oh, there's a lot of questions that I don't think we can answer.
Yeah,
We
that's
can
what I was
try,
thinking.
but I don't want to give any medical advice. Keep in mind, this is not medical advice here. We are just shooting the shit with
Yeah.
Just having
fabulous
a casual
group from Salem
conversation.
and encouraging folks to access services through HIV Alliance.
Absolutely.
Uh,
What about this one? I mean, we can help with our experiences, I guess. I'm inexperienced with receiving anal sex. What are good tips to make it more comfortable?
ooh,
Once again, I like this one. You just gotta relax. It sounds crazy, but relaxing is very key. And then obviously lubricant is
Yeah, very important. Lube, lube, lube. Oh, that's right. And if you think it's too much, you might not, or there's not really much such thing as too much, honestly, when it comes to something that can be as uncomfortable as anal sex initially.
I know what kind of lube is that? Like the water-based is really like awful.
Well,
Sticky.
so it depends if you're using a condom or not, because water-based is better for it if you're using a condom, whereas silicone can damage the actual latex. So it'd be obviously unsafe to use with that. But if you're not using a condom, silicone is definitely more slippery, I find in my experiences. And also, take your time, warm it up. There are ways to start stretching, beforehand.
Don't rush into
Do
it.
not just
No.
go right for it. That's never a good idea.
I feel like the pre-activities are, a big part of the fun. So,
Absolutely.
working with your partner, understanding each other's bodies, communication,
Oh, yeah.
being able to share, what your limits are, if something is too painful, if you need to go at a different pace. I find that, having a partner who's able to communicate is really important when being able to work, our bodies up to a certain level to make it comfortable for each of us.
Yes.
And then Christina also put in a plug can help. Practice makes perfect.
True.
I mean, I have never, but to each their own. And
They
if it helps
do
you,
make the full tapered up, so you can always start with something smaller and work your way up.
Completely. Let's look back in here. Well, maybe we can talk about this. how do I lower my risk for STDs?
Condoms is like the number one thing to say.
That seems like a really big one. So where do folks find condoms?
I mean, you can get them almost anywhere, like grocery stores, gas stations.
There's bars, you can reach out to HIV Alliance, your doctor, there's clinics. I mean, they're very much everywhere. So I mean, if you're struggling financially,
you can get them free.
you can get them free. Yes.
You can go into a Planned Parenthood, HIV Alliance. Yes, if you are, in a public school setting, typically the school nurses will have them. Like there's all kinds of resources out there to get them and to not have to pay for them.
Yeah. It always blows my mind when I see condoms for sale, because I'm just so aware of all of these community resources that provide them for free. So even with HIV Alliance, you can go online through our website, fill out a form, and have condoms shipped to your door. We do that with lube as well. But as the rest of the crew mentioned, you could go to a bar bathroom. Often there's a little vending station. You could go to Planned Parenthood. You can run to the convenience store. They're available. You just have to know where to look. And I think there's other ways that we can also reduce STD exposure. And some of those methods include being prescribed PrEP, especially for those who are, concerned with HIV exposure.
Absolutely.
For those who are unfamiliar, PrEP is pre-exposure prophylaxis. And I often say that this is, the birth control to PEP's Plan B, where it's a medication that you take daily that reduces your chance of acquiring HIV by nearly 99.9%. It is an effective medication when folks adhere to a regular regimen. And so in order to get prescribed PrEP, we do have a PrEP clinic out of our Eugene office. We have PrEP providers across the state. There's assistance if you're concerned of the financial barriers. You can walk into pretty much any provider and share that you're interested in acquiring PrEP. It's becoming a name brand at this point. Folks are familiar. In some rural communities, it's a little more difficult as providers are still trying to understand new advances in medication. But you can reach out to our staff at any time. Christina is more than willing to connect folks to these services and get folks prescribed. If you and your partner are of mixed status, it is really good for your relationship not to be concerned of an HIV exposure. So we see a lot of couples where one partner is HIV positive and the other partner is HIV negative. And in order to reduce the risk of transmission to virtually zero, one partner will take PrEP and the other partner will just make sure that they're adhering to their medications, and the risk, for them to transmit to one another is virtually zero, which is incredible. So the fact that we can have mixed status relationships really speaks volumes to the advances we've seen in HIV treatment in the field.
And the stigma too of not dating or marrying someone that's positive too.
Like it's really not an excuse, it's just absolutely ridiculous that anybody could still think that that's a negative. Like you can absolutely make something great out of a relationship, even if somebody is HIV positive or not.
Right.
And then, Christina just threw into the chat another point that it's not just for men who have sex with men, but it's for other folks who are at high risk of acquiring HIV. So this could be, people who inject drugs. That is another target population that we're really trying to work with to ensure that they're not acquiring HIV at a higher proportion than we've seen historically. But one thing that this kind of segued into is what is undetectable. And when we talked about mixed status relationships, I feel like this is a really important piece for the community to understand in terms of breaking stigma. So undetectable refers to when someone's viral load is so low, and when I say someone, I mean it's someone living with HIV, so an HIV positive individual who is taking medications, to where the medications suppress the viral presence of HIV to to such a small amount that it is practically untraceable. And so when a person is undetectable, oh gosh, where do I want to, okay, I'm trying to go back. I'm having a brain fart at this. U equals U. Oh, undetectable equals untransmissible. So if a person is undetectable in terms of their viral load, they are not able to pass on HIV. So this untransmissible. And this is huge. This is why individuals should be, working towards becoming medicated, to having their labs done, to working with a medical provider to prevent transmitting the infection to others. And just because someone's HIV positive does not mean it's a death sentence. We are able to treat and work with these folks. It's now a manageable condition. And so if you're concerned that your partner is HIV positive, just kind of step back and think, is this person taking the medication that they need? Is their viral load undetectable? Am I doing what I can to protect myself in the situation? Maybe I should be looking at PrEP in order to bring that, risk of transmission to practically nothing.
Right, absolutely. Great advice.
So we talked quite a bit about lowering risk for STDs. I think
we didn't get onto that they should be regularly getting tested if they are sexually active, especially with multiple partners. That is one of the best ways to prevent, spreading. That way, right away if you have one. At least getting a schedule of testing makes it a lot easier to, catch it before you've spread it to more people.
Well, and similar to COVID, a lot of folks are unsymptomatic. Like people are unaware that they are carriers of certain infections, whether that's chlamydia, gonorrhea, HIV, COVID-19. So one of the only ways that you can be certain that you are, negative for these viruses, infections, bacteria, is to be tested and to do it on a regular, cycle. And so if you're sexually active and you know that a risk of exposure occurred, go ahead and get tested. Have that peace of mind and know that you can engage in a sexual relationship with another without the fear of transmitting any potential infection.
Yes, absolutely.
Cool. Okay, so let's look on here. Ooh, so this is one that I hear quite a lot. And maybe folks can throw out some of their ideas on why this might be the case. But why are gay men most at risk for HIV if straight people can get it too?
That is a very good question.
That is very good.
And I wish I knew the answer, but I'll be honest, I do not.
Well, and no pressure. I can answer this one if folks don't have any ideas.
I mean, I know that obviously anal sex is very different than vaginal sex. And there's definitely more risks of like tearing, not to mention absorption of your intestines and whatnot. And colon is literally meant to like absorb like the moisture and stuff as you're digesting things. So I'm imagining that has something to do with it, but I'm not 100% sure.
Yeah, so you're definitely on the right track. And Christina kind of shared a little bit more of how the anus tissue is very soft. And any sort of friction can cause a tear, which creates an opening for the HIV virus to enter the bloodstream. So anal sex between partners is a high risk. And, when we talk about gay men, that is one of the prominent, sexual activities between two male same-sex partners. However, I think there's also this misconception that heterosexual individuals are of low or zero risk to the HIV virus. And I'm here to debunk that. That is completely untrue. And here in Oregon, we see heterosexual individuals account for anywhere between 5 to 10% of new infections. So just because you're heterosexual doesn't mean that you're immune from acquiring HIV.
Yeah, it's not just the gay disease that they used to call it, and some still do.
Mhm.
Yeah, some people still believe that.
And, in Oregon, I think it's nearly 25% are people who inject drugs, and nearly 60% are, men who have sex with men. So that's kind of the broad picture, not just gays. We have folks across the board, and, it's important for folks to understand that HIV impacts everyone.
Yep.
Well, going through, I feel like this is pretty much as we're able to answer. But, looking at the time here, I just want to be aware that, we are immensely appreciative of all your time coming here today, for all that you do in the community, giving back through our Red Dress Affair, putting on your makeup tonight and sitting down and answering some of the questions shared by our fans. We're hoping that, we'll be able to answer all of these questions and share a transcript with, our complete donor base as well as followers. So keep in mind, this will be made available, and of any of the questions that we weren't able to ask today, we'll work with some of our providers to have answered and
Awesome.
share when we share out the link.
Very nice.
Love that.
Yeah, and then one quick plug, we just want to let folks know of our services here at HIV Alliance. We offer free HIV/hepatitis C tests in the Eugene office on Tuesdays and Thursdays from 3 to 7, as well as, well, Christina said, as well as other times that she can't recall. We have all of our testing sites and locations on the website. We do HIV and hepatitis C testing in our Douglas, Salem, and Eugene office. We also operate out of Jackson County for our testing services, and occasionally, I want to say Curry and Coos. My memory is not always the best, so I encourage you to visit our website to get those exact details. And we do walk-ins, so no appointment necessary. Once again, these services are free, confidential. You don't need an appointment to schedule. And we have our PrEP and STI clinic as well. So as we're continuing to build these programs, we're going to get them expanded across our entire service region.
How long does it take to get tested?
To get tested, it depends on your test received. Christina, do you have the exact time? 20 minutes.
Or so, right? Because some people think it's weeks, weeks and weeks away until you find out or something. But good to know, 20 minutes ish.
Yeah, 20 minutes, come in. I believe this is for our oral test. And so all it is practically a cotton swab that you just, put on the inside of your cheeks and move in a rotational fashion, dip it in a cup, wait 20 minutes, and have your result instantly.
Amazing.
Yeah.
Yeah.
Technology is crazy these days.
Okay, well, I just want to say thank you once again. I'm sorry that Becky was unable to join us today, and we'll follow up with Dr. Alkire to see if we can get the questions answered for the rest of the group. But
Yeah,
thank you
great.
so much.
Thank
We
you,
love
Jennifer.
both. Cool. Well, take care, everyone. I'll catch you later.
Bye.
Bye.